The CymActive bladder management system consists of three parts. The CymActive intraurethral catheter with Eurovalve, the IUC, the CymActive inserter, and the CymActive actuator. The CymActive IUC is retained in the bladder by a malacot and ends in the upper part of the penile urethra. Similar to an indwelling Foley catheter, it spans the bladder neck sphincter, the prostate and the external sphincter to provide relief from urinary retention. The Eurovalve is magnetically closed, meaning that until the patient decides to empty the bladder, the fluid path is closed and the bladder will fill. By bringing the CymActive actuator into proximity with the Eurovalve, the fluid path is opened and the bladder can drain. Once the actuator is removed, the Eurovalve magnetically closes again. To open the Eurovalve requires a very strong actuator magnet. When the actuator is brought to within approximately 3 to 4 centimeters of the Eurovalve, it draws the internal magnet away from the valve seat, permitting urine to flow through the urethra. A bladder containing about 375 milliliters of urine will take approximately 60 seconds to empty completely. Once the actuator is moved away, the valve will close, and this prevents urine from passing through the system. The CymActive IUC with Eurovalve comes pre-assembled to the CymActive inserter. Notice that the malacot is expanded so there is no stress on the silicone during its shelf life. The CymActive IUC device is quite flexible, but importantly is locked to the inserter at both the proximal and distal end. This means the device will not stretch during insertion. If you pull the inserter back 1 centimeter during insertion, the entire device will pull back 1 centimeter. The proximal lock and distal lock also serve as important safety features, ensuring that the pusher tube remains captured until purposefully disengaged. This has been designed to minimize the risk of trauma to the urethra. The insertion procedure begins by collapsing the malacot. You do this by mating the male and female handles. Slide the male handle forward by gripping the blue handle to engage the extended portion into the female handle. Press firmly in without rotating the pusher tube and then turn the clear collar to hold it in place. Be careful not to rotate the male handle or twist the pusher tube more than 45 degrees in either direction. Be sure the coude tip and vent both point up and are aligned. Now, lubricate the urethra with a water-soluble lubricant and begin the insertion. The malacot arms will not collapse completely, but will continue to collapse as they pass through the meatus. Insertion is very similar to inserting an indwelling Foley catheter. Correct placement of the CymActive IUC will be confirmed by urine flow into the clear inserter tube. To ensure that the malacot is fully inserted into the bladder, continue inserting the device approximately 4 to 5 centimeters before expanding. To expand the malacot, unscrew the clear collar and remove it from the female handle. Pull the male handle back gently to expand the malacot and gently pull back on the female handle to position the malacot at the bladder neck, at which point you'll feel some resistance. To remove the inserter tube, the 2 locks must be disengaged. To release the proximal lock, rotate and pull the protruding locking wire handle back until the locking wire is fully removed. Next, to release the distal lock, completely remove the pusher tube by pulling back on the male handle. Now the inserter simply comes apart and can be removed, leaving behind the properly placed CymActive IUC. Only the 2 extraction tethers will be visible. These can be trimmed if desired. When the device is to be removed, simply grasp the 2 extraction tethers and pull gently. Notice that once the device sees gentle traction, the shape of the malacot will collapse and the device can be removed. If the tethers are internal to the meatus, they should be grasped with forceps and gently pulled. Alternatively, using a cystoscope, the extraction tethers or Eurovalve can be grasped directly to remove the device.